time now for the hot sauce. Unfortunately, most of us knows what it feels like to have a broken heart. We often think of it as an emotional state or a psychological state of mind, but actually it is a physical condition, broken heart syndrome. Today in the studio, we have Dr. Vinay Mehta, a cardiologist with the Buffalo Heart Group and Catholic Health. Thank you for joining us. You and I were speaking. You said this is actually something that's relatively in the medical world, a relatively new condition.
That's exactly right. In fact, I'll tell you an interesting story about this. One of my professors, in fact, had a patient about 30 years ago, a woman who had an argument with her son. And she came into the emergency department. She had chest pain and shortness of breath. Her EKG was very consistent with a heart attack. They did some blood work. That was very consistent with a heart attack. They did an ultrasound of her heart. That was very consistent with a heart attack. And then subsequently, they did a coronary angiogram, looked at the blood vessels of her heart. And when they did that, the coronaries, the blood vessels of the heart, were pristine. They were open. And that is the hallmark of a heart attack, isn't it?
Right.
Having blocked blood vessels. And she didn't have them. So, he reported that as a case report and gave it a very nerdy kind of name. Never got published. He kept on trying to get it published for about 2 years. Didn't happen. So about 10 years after that, the Japanese really saw a similar kind of presentation and gave it a cool name, Takotsubo cardiomyopathy, or an octopus trap, like cardiomyopathy, because that is how the heart looks in this condition. And, about 5 years ago, I was in a cardiology meeting, and you couldn't get away from broken heart syndrome.
Really? And, broken heart syndrome, for us, that is a name that resonates with us. And there is an emotional connection to this physical response?
There really is. Most often this happens after an episode of emotional or physical stress. And it is virtually indistinguishable from a myocardial infarction or a heart attack till you do a coronary angiogram in which the blood vessels of the heart are clean. They don't show any blockages. And the interesting thing about this is that the heart, when you look at the heart itself with an ultrasound, it shows significant dysfunction.
Really?
The ejection fraction or the pump function of the heart decreases significantly from a normal of, let's say, 55 to 60% to anywhere from 30 to 40%. And it usually has a particular pattern that the apex of the heart, one part of the heart, really stops functioning well. And if you look at the EKG at that time or the blood work, that is very, very consistent with a heart attack.
How dangerous is this for patients?
The one good thing about this is that most of the patients, if given the right supportive treatment, heal. A broken heart heals itself.
That's wonderful.
If given enough time and support. Usually it takes about a week, 1 to 4 weeks almost, for it to recover. But about 90–95% of the patients, if not more, recover.
That's wonderful news. I imagine if you're feeling some of these symptoms, you should always contact your doctor.
Oh, absolutely, because you cannot tell whether it is a heart attack, a myocardial infarction, which might need immediate treatment, versus Takotsubo cardiomyopathy or broken heart syndrome, in which the treatment is basically supportive. Having said that, especially in the acute setting, there can be bad things that happen, including arrhythmias, irregular heart rhythms, blood clots, and other things. So in the acute setting, at least, there should be, these patients should be admitted to the hospital, observed, and possibly supported by pain medications and intravenous fluids and other things.
All right, very good. Thank you, Dr. Mehta. We appreciate you informing us on this. And remember, heart disease is the leading killer of both men and women in our country, so please take care of your heart. Now we're going to send things over to Emily.